Live, I'm Josh Fenton, CEO and co-founder. It is hot and humid. And no escaping that for the next, at least today and into tomorrow. Then we're supposed to get a little bit of a break, according to GoLocal's John Giorgi. Let's also catch up on the Washington Post has rated Rhode Island as the 6th most corrupt state in the country. One caveat to that is, of course, the Washington Post is owned by Jeff Bezos. ProPublica did a big expose on the richest men in America, many of which were capable of avoiding paying almost any federal taxes for a number of years. So Jeff Bezos' Washington Post is saying that we're one of the most corrupt. I guess ProPublica is raising questions about Jeff Bezos' ethics as it goes to his tax payments. Let's go to Dr. Michael Fine. He's the former director of health. And he's got all the numbers, and they are not good, Dr. Fine.
They are not good at all, Josh. We're up to 152 new cases per 100,000 per week, 268 new cases on 7,700 or so tests. That probably is equivalent to about 750 new cases if you equalize the numbers and if we were doing full testing. There are now 89 people in the hospital. That's up by 12 in 24 hours. And 12 people in the ICU. What I heard on a provider call from the Rhode Island Department of Health is that they are thinking that there will be 250 to 500 people in the hospital by the time this surge is done, that we will occupy 80 ICU beds, really maxing out our capacity. And that there are probably 10,000 to 20,000 people in Rhode Island today walking around with active COVID-19.
Not good. We looked at the numbers. You have to go back to really the middle of May to get this amount of hospitalization. So 3 months ago, and this in just the last 3 weeks is almost a 370% increase in hospitalizations. It is what we didn't want to have happen.
And it is happening now, and the projection is it's going to get worse. They're thinking that it's not going to top out until just after Labor Day. And if the number of they're thinking that 7% of positives will lead to hospitalization, so we will see a lot of people in the hospital. We're going to max out and tax our healthcare workers again. And with this level of community transmission, you can expect to see this disease getting back into the nursing homes, causing breakthrough and causing infections in the nursing homes again, even though people have been vaccinated. And of course, you'll see many people who are not vaccinated in the hospital. And I fear too many preventable deaths. We should be upset about a single preventable death. And I think we're going to see a significant number.
Yeah, go back 1 year ago, almost exactly to the date, the Raimondo administration announced at that point that if you were over 100 cases per 100,000, you couldn't open your schools as a community. That ended up being only Providence, Pawtucket, and Central Falls, if my memory serves me well. We're now talking about a statewide average of 152, and in many cases, the new upswing in cases are in places like Newport and Westerly, correct?
Yeah, in fact, Newport and Westerly are the most infected places in the state this week. I don't know what's happening in Block Island. They have been heavily infected before, but there was not much testing last week, or not much reported testing. But Central Falls is back up there, unfortunately, at 197 new cases per 100,000 per week. This is what we were afraid of because of the demographics and the sort of way people have to live in Central Falls. But it's happening again.
Doctor, the new political sport seems to be the coronavirus. Democratic candidates for governor, Nellie Gorbea fired at Governor McKee, saying the state should require masking in all schools. The McKee campaign fired back saying, mind your knitting to some degree. And we have data that you don't have because we're the governor. And when GoLocal followed up on that and asked them for that data and what the sources were and what public health experts in the country aren't calling for schools to be masked, they couldn't produce any either data source or a public health experts. Sadly, this seems to be going to be the game for a bit, correct?
No, I hope not. I mean, we don't need a circular firing squad. What we need is everybody working together, getting everybody vaccinated, everybody masked, and everybody tested twice a week, period. We don't need games.
So about 20 minutes ago, before we came on air, Seth Magaziner, the general treasurer of the state of Rhode Island, another Democratic candidate for governor, issued an updated policy for his office. And it was that you couldn't come to work unless you are vaccinated or you have a valid test each week that shows you are not infected. Why this bifurcation? Why would Seth Magaziner, like the Secretary of Defense, who has said to the United States military, get vaccinated, the clock's on the field, whatever he gave them, 6 weeks, 8 weeks to get vaccinated, why isn't Seth Magaziner just demanding that his staff get vaccinated?
Well, I can't answer that, but I think a lot of this get vaccinated or get tested thing is coming from CDC, and I think it's wrong. I think they're conflating two different needs. One is the need to get everybody vaccinated. That protects the people who are themselves employees and are currently unvaccinated. They're the people most at risk from staying unvaccinated. But the idea of testing, if testing is done right, you pointed this out to me a year ago, that the colleges were doing it right by testing everyone who's, sort of in a congregate setting twice a week and testing them with PCR. That's what we need. That's the expectation we should have for any business or office or congregate setting, that we test everybody twice a week, vaccinated or not, so we can identify people who become infected and ask them to stay home. Remember, there's been evidence of plenty of breakthrough and plenty of evidence that lots of people who are vaccinated will get infected, though thankfully they won't need hospitalization or be at risk of death, or as much of a risk of death. So what we need to be doing is testing every single person twice a week, vaccinated or not, and we need to be requiring vaccination in, I think, anybody who works in a public environment supported by public funds.
Okay, so hospitals are now requiring employees to get vaccinated. I think that's an October 1 deadline. Rhode Island Hospital, the Lifespan Group, as well as Care New England issued that, I want to say 3-4 weeks ago. The governor extended it to all others. Nursing homes, I don't believe, are falling under that requirement yet. And nursing home vaccination rates are reported to be exceptionally low, below 60%, and in some cases below 50%. So below the state's average. And they are working with the most vulnerable people.
Well, actually, Josh, what I'm hearing from the Department of Health, and I haven't seen this on paper yet, but what I heard on that call was that every healthcare worker is going to be required to be vaccinated, even if they're a receptionist or a secretary. Every single person is going to be required to be vaccinated, and that is a great move forward if it's true.
Okay, state employees are not required to be vaccinated.
Right.
Okay, National Guard, as best as I can see, the Department of Defense's mandate only requires active members, and I don't believe the governor has given utterance relative to the Rhode Island National Guard and the Reserve as to whether or not they should be. Seems like a mistake, because aren't they really, in many cases right now, healthcare workers?
Yeah, and they are, we need them to be available to stand up and defend us. National Guard, police, EMTs, firefighters are all people who we need to be able to function. And if they're not vaccinated, and my understanding is that 50% of EMTs are not vaccinated, but if they're not vaccinated, they're going to get knocked over and be pulled offline over the next few weeks as this thing spreads. We can't afford that.
And then school employees. I mean, the masking's great, but wouldn't it be even better if all students older than 12 and all faculty members, teachers, administrators, cafeteria workers, they were required to be vaccinated?
I think so. I mean, that's the way you defend them best and prevent spread in this public institution called public schools. That's where you really want people to be vaccinated because, for better or for worse, the schools will be places that the virus continues to circulate even when we get a higher proportion of adults vaccinated because the kids aren't going to be vaccinated yet. And they will continue to be the reservoir of disease. So we got to protect everybody, and do everything we can to reduce community transmission, or we're going to have more preventable deaths. I fear the number of preventable deaths we're looking at, and boy, I think we should be doing everything in our power to prevent those deaths.
Dr. Fine, the FDA approves booster shots in certain circumstances. Those who have lack of full protection, those that have had organ transplants, I think those suffering from cancer in certain situations, a bunch of other categories. They did not extend that to those who are highly vulnerable, those 70, 80, 90, 100-year-olds who are often in environments like nursing homes. Why stop where they stop? Why didn't they take it to the next step?
Well, to be honest, I hadn't seen the FDA approval of boosters yet. But if that is correct, I think the challenge at the moment is that boosters have not been adequately studied. That, we don't know whether there's a risk associated with the third shot, and whether any risk of a third shot is greater or less great than the risk of getting the disease and breaking through. So until that is well studied, it's going to be a hard thing for FDA or CDC to coherently recommend. I have actually heard recently that if a physician or nurse practitioner or PA authorizes a vaccine for someone as a booster, the message has gone out that they are liable if anything goes wrong. And so there's kind of an effort to keep people from offering boosters at the moment.
So no boosters here for those categories, but in Israel it's 60 and older. They're lining them up.
Well, everybody's got a different sense of how to do the science. And I sort of see and hear both sides of this. Certainly we want to be able to move forward quickly when we have evidence, but I am also cautious about moving forward until we have the evidence, so we get to practice that part of our oath that says do no harm.
We'll see how that gets handled, especially if nursing homes start having significant outbreaks. I think the politics may overcome the science.
Politics overcoming science in the United States in the last year and a half? I'm shocked.
Dr. Fine, what are we looking at? You say the Department of Health is identifying Labor Day as the peak, so that's about 2.5 weeks away, 3 weeks away. How bad does it get, and is it a fast decline from sort of that peak early in September, or is it a quick decline?
So these are all projections, and some of them have to do with how many more people we can get vaccinated. In the United Kingdom, it was a relatively quick decline, but they are more vaccinated than we are. So my guess is it will not be a quick decline. that we're talking about 6 to 8 more weeks of, high levels of community transmission, and people who are older at risk and people who are unvaccinated at risk. And we still have to sort out the extent to which kids are at risk, something that many of us are very worried about. So I think we're in for a kind of interestingly rough time, because it doesn't sound like government is stepping to the plate. I think this is actually the time when people themselves should step to the plate. When people over 60, until they're boosted, should probably avoid bars and restaurants, and not shop, even if they're vaccinated. And it's a time when everybody should choose to wear masks themselves, even if the government isn't forcing you to do it. This is something that we can take on together, whether the government is with us or not.
Dr. Michael Fine, as always, thank you very much. For everybody, stay tuned for much going on in Rhode Island. A heat wave, coronavirus numbers up and through the roof, more than a tripling of hospitalizations in the last 3 weeks, and a transmission level of 152 per 100,000. The action level is at 100, so we're in the middle of it, and it's going up and up. Stay tuned, stay safe. If you haven't gotten vaccinated, don't know what to tell you. Unfortunately, you may end up in that hospitalization category, and hopefully not in the ICU or on a ventilator. But there's no mandate to be vaccinated for all Rhode Islanders. Everybody stay safe. Thanks, everyone.
Thanks, Josh. Get a shot, wear a mask, get a test. We'll fix this together, ourselves.